My name is Dr. Mohit Bhutani. I'm a professor of medicine at the University of Alberta and a practicing respirologist in Edmonton. So there are some similarities and differences between COVID-19, influenza, and the common cold. And in this video, we're going to discuss some of those similarities and differences between those infectious agents. COVID-19 has a long list of symptoms that can affect people. Influenza and COVID-19 do share some of those symptoms, and it can be very difficult to differentiate between symptoms of influenza and symptoms of COVID-19. Some of those symptoms include high fevers, cough, and really a lot of fatigue, which are the three symptoms that really overlap between influenza and COVID-19. Ultimately, to differentiate between the two of them, it does require diagnostic testing and getting a swab done to see whether or not you have COVID-19 or influenza. And when we contrast that with the more common cold, some of those symptoms like high fever, fatigue, other things like joint aches, muscle aches are not as common with the common cold as they are with influenza or COVID-19. So some of those symptoms can help you differentiate between the two. So I think what we've learned over the last several months of the pandemic is that anything we can do to reduce our risks of contracting any type of respiratory infection is paramount. And in this sort of evolving world where the COVID-19 numbers are starting to increase, anything you can do to reduce another infectious possibility that might be similar to COVID-19 should be done as readily as possible. Knowing that you can get an influenza vaccine that will decrease your risk of getting a virus that mimics COVID-19 should be taken very seriously and considered very strongly. The importance of getting the influenza vaccine is that if you, for example, develop those symptoms of headache, fever, fatigue, and you're concerned that you got COVID-19, you're now going to have to go get testing. You're now going to have to self-isolate for 14 days, and it's going to have a real impact in terms of your quality of life and the things that you do on a day-to-day basis. So the advice for myself to my patients has not changed in all the years that I've practiced. We realize that influenza is a problem on a seasonal basis. We've gotten very concerned about this during COVID-19 about hospitalizations and surge planning and healthcare utilization has become very top of mind for lots of people, as well as the sort of governments and the public in general. Every year, our hospitals are full of patients who have influenza. We have around 12,000 patients per year that get admitted in Canada for influenza infections, 170,000 emergency room visits on average. And with that, around 3,500 people per year die because of influenza. And so my recommendations for influenza don't change whether we're in a pandemic or not, is that we should get the vaccine every year. Everyone who's eligible to get the vaccine, which is anybody 6 months and older, should get the vaccine to help reduce the risks of them contracting the influenza virus.